Good evening, Suresh sir. I'm here only.
Good evening. 2 minutes. 32 will begin the session. So just a minute. I will share my slides.
Yes. I've initiated the recording also.
Yes. Okay. Okay. Fine. Yes.
Can I start?
Sir, Balu sir, good evening. Can be in another 1 or 2 minutes max. 2 minutes, sir.
Sir, we will begin the session, sir. Veera, sir. They will join.
Sure, sir. Yes, sir. Yeah. Good evening, one and all. I'm from Mental Health Webinar Series 2020. Today we have 255th session. It's of course Child Rights and DRR by our Dr. Balu, who is actually a faculty of NIM. And of Department of Psychology, the American College, Madurai, and the core team Mental Health Webinar Series, Madras School of Social Work, Chennai, International Center for Clinical Psychology and Psychotherapy, Germany, Yamachalamuthi Institute of Mental Health and Rehabilitation, Psychological Research Center, Madurai, Psycho-Oncological Association, Turkey. Because of all the organization, associate partner, I welcome one and all today's speaker as well as the sincere participants who are all joined over here. To have a great session, I request all the participants to mute your video as well audio, and all your queries can be clarified in the question and answer session. And make sure to wear decent outfit if in case of switch on the video. I request our team head, Dr. Suresh Kumar, to introduce our today's speaker, Dr. Balu. Thank you. Please, sir.
Yeah, thank you, Veera, sir. I'm happy to introduce our friend, Dr. Balu. Dr. Balu is working as a faculty at Dr. Balu is working as a faculty at CDRR at the NIDM and National Institute of Disaster Management, Ministry of Home Affairs and Government of India. And he is having he served as an assistant professor at Rajiv Gandhi National Youth Development. It is one of the Institute of National Importance. And he also having 2 years of research experience at National Institute of Rural Development and Panchayat Raj, NIRD and PR. Overall, when you collect his experiences in the field of community level, and for child-related component, he is having 10 years of experience. For his credit, he is having PhD at Sociology from Madurai Kamaraj University. He has coordinated national and international level training programs on various themes. And as per my knowledge, when he was entered in that NIDM, and every year he is conducting more than 40 face-to-face training program. I'm happy to welcome today's speaker, and for his credit, he is having publications in journals and conference. Over to you, sir.
Thank you. Thank you so much, Dr. Suresh Kumar. It's audible to me.
Yes, sir. Okay, sir.
Just let me share my PowerPoint.
Okay.
and also other opportunity. And first of all, I congratulate Ashma for organizing the series of Mendel. It's all risk reduction on
Your voice is breaking, sir.
Pleasure for me to again having a network. Close my video. My laptop also may restart. Yeah, I'm continuing with this. So I have decided from the rights of other human rights, and basically General Assembly adopted this convention for signature on 20th November 1989, and it came to force on 2nd October 1990 and ratified by more than 160 countries across the world. And this UNCRC, which applies to all the children in all the contexts, especially like rural, urban, tribal, or refugee children. So it applies to the all the children in all the contexts. That is the unique of this UNCRC. And this state governments means all the governments who have signed the responsibility to ensure the human rights are respected and protected and fulfilled. And at the time, in case any state government or central government, they were unable to fulfill the child rights at the time of humanitarian crisis, and these humanitarian or international level organizations like the UNCRC or UNICEF, WHO, they are attempt to provide assistance. We have seen in many disaster situations like cyclone or earthquake, this UNICEF and WHO, they used to provide the basic necessities like providing water and food and shelters, because these are the basic important rights of the children as well as human people. So that's why these international organizations were trying to fulfill those rights, even if the governments are failing to attempt this. And the way the assistance is provided can greatly affect the recovery of children and their families and communities. For example, if any disaster like the earthquake happens, and the support which we are giving to the people will help to recover their family. For example, if you are providing, if you are taking care of their children, and the family can be very much work on their recovery of their livelihood and all other aspects. In case if you are not providing such protection to the children, the families are also need to look on their children, so they may not able to concentrate on their livelihood activities. Okay, that's the reason these assistance were provided to the children, were helped to recover their family. And overall, in this UNCRC, there are 54 articles. Articles which all covers the four important rights like a civil, political, economic, and social and cultural rights of the children. And this UNCRC also need to work to protect humanitarian crisis or in any emergency situation. Okay, so we will discuss in these all articles on the rights which is given in UNCRC. And we are not going to discuss about all the 54 articles which is given in the UNCRC, but we will see some of the basic rights of the children and how it is being affected at the time of disaster situation, right? And there are four major general principles given in this United Nations Convention on Rights of the Children. The first one is best interest of the child. So what it says that whatever the decisions which we are making, or the government or any organization which they are designing the schemes or implementing any schemes, that should be based on the best interest of the child. It should be supported for the development of the child. And the second one is non-discrimination, right? So at the time of implementation or designing any policies or programs, there should be no discrimination. It may be a male child or female child or refugee child or the children from any countries. There is no discrimination among those children. And these other articles also develop based on the development principles. And also, what are the decisions which we are taking? It should be based on the views of the children. So suppose we are implementing some schemes or designing some policies, the children's views also need to be heard. That's what this UNCRC says. So overall, if you see this UNCRC has been developed based on the four major general principles which we are discussing right now. The best interest of the children and non-discrimination, development and views of the child. All 54 articles and major rights, we can divide into four major rights. Okay, the first one is survival. It is related to right to live, right to survive. Okay, and the second one is the right to development. The right to development is like right to education, right to health facilities, and the right to participation. Okay, the third one is protection, to protect the children from various issues. And everyone is having a responsibility of protecting all other children and stakeholders. And the fourth major rights is participation, participation in various activities or other things. Okay, so overall, what we can see is this UNCRC's rights has been divided into four major rights, which is right to survival, right to development, and right to protection, and right to participation. And this UNCRC also talks about right holders and duty bearers. So one side, the right holders like children, parents, and in case of absence of parents, the guardians, they all are right holders. Okay, and the duty bearer like all state government, central government, local, international organizations, and all the land departments, especially people who all are working for the welfare of the children, they all are called duty bearers. Okay, so it is strengthening the accountability mechanism between right holder and duty bearer. Okay, among the right holder, once we need to develop the awareness about their basic rights. And second, among the duty bearers, we need to educate them to realize their responsibilities, so that at the time of any disasters or humanitarian crisis situation, both the right holders can fight for their rights and the duty bearers can protect and fulfill the rights of the children. Okay, so overall, it's a strengthening the accountability mechanism between right holder and duty bearer. Now, I would like to ask a few questions. Also, like to interact with the participants. Can anyone say who is child? You type, or you can also interact with me. As per your understanding, who is anybody would like to answer? Who is child? In our country, we have a different definitions for children. There are various definitions for children. That's why I'm asking about to know about your understanding. Okay, anyhow, no issue. Let's see. If you take a marriage act for a boy, it's below 21 years. They are children. For a girl, it's below 18 years. Now there is a recent change is also going to happen. It is in the process. They are going to increase the marriage years for the girl children also. So as per marriage act, for the boy, it's below 21 years. They all are children, and for a girl, for a boy, it's below 18 years, and for a girl, it's 21 years. Okay, so, and if you take a Child Labor Act, the people who are below 14 years old, they all are called children. Okay, and here we are talking about United Nations. International level, if you see the children who are below 18 years old, they all are called children. So the people who are below 18 years old, they all are called children. Okay, we also will discuss, okay, below 18 years, they all are children. In that case, the child starts from which stage? So when a woman get conceived, when a woman gets conceived or in the womb stage, from that stage itself the child rights starts. When a woman get conceived or the child in the womb, that stage onwards the child rights has been started. Okay, so as per UNCRC, the age of 18 years old, they all are called children. And applies to all the children irrespective of their race, religion, ability, and gender. Okay, it may be a boy or girl, or it may be Hindu or Muslim, or any caste, or differently abled or normal child. So this, all the rights which is being given in this UNCRC is applies to all the children. There is no discrimination. Okay. Now the children have, as per Article 12, the children have the right to say what they think should happen, and when the adults are making decisions that affects them. So just the child should start from this self. We need to give our rights to our own children. If you come and see, visit my home, you can find a lot of drawings on the wall. From that pictures on the paintings, that speaks their rights. Okay, if you see like and many people, if you visit any home, they are very much strict with their children. Don't do this, but it's all affecting the rights of the children. Okay, so it's a right. The children has a right to speak, and on behalf of the children, when we are making a message, we are taking a decision, it affects them. For example, in a coastal area, if you are constructing a relief center, okay, and without involving children, and if you are making a decision to construct it, it won't reflect the views of the children. And suppose the engineer, they may design the steps little bit height, and the toilet facility which is maybe designed may not appropriate for the children, and it's not appropriate for a woman. So that's the reason we need to involve children also. Okay, so the children has a right to speak. And I remember just past 10 years before, I was doing a community-based disaster risk reduction. For that purpose, I was conducting a PRA in one of the village in Nagapattinam district. And at that time, I was called, I have teachers, women, and elder people for conducting a PRA to prepare a village community-based disaster risk management plan. At that time, when naturally there is a crowd, what happens? The children also maybe used to come, but I was seeing them as a disturbing my process. So I told all the elders to send their children back to their home. So now I'm realizing it is also important to involve the children, and the children are having a right to say. And when we are listening to them, we can include their perspectives also in the disaster risk management plan. And just I would like to ask you people, how many of you are allowing your child to speak, or involving your children in decision making? If you are involving your children in decision making, you can just speak out how you are involving, or on what aspects you are involving your child in decision making. You can also type in chat box. You also can speak. It's up to you. If you are involving your children in decision making, give me an example how you are involving your child. Or
well, for higher studies, probably.
Okay, can you a little bit elaborate, sir?
Definitely, as a parent, I can say I allow my child to choose whatever he wish. Probably, if he is more interested in science, let him study science related.
Okay, that's good. Thank you. Any other? If you are involving your child in the decision-making process, can you explain for what purpose or what are the decisions you are involving your child? See, before once a man get married, the wife used to ask your husband, "Hello, what, darling, what do you want to have today?" So the men used to decide, right, what food need to be cooked today. But after once you are having a child, the decision making authority goes to the child. Many houses I could see that the mom used to ask their child, "What is the menu to cook today?" That's what happening. The men or the husband are neglected here. So I'm just joking here. So here, if you see why I'm saying this is the children also need to be involved in decision making process. One thing, it is their rights. Okay. Second, if you are involving the children, you can fulfill their needs. They only need what they want. See, I was just observing one of my neighborhood. He always used to buy dresses for his children. Won't even allow his wife or child. And many times when he bought a dress, it won't fit for the child. See, this is one of the example. If you are not involving your child in any activity, what happens? There is no use of it. It's waste of time. It's waste of money. The same is applied in the field of disaster risk management also. If you're not involving the children in the other activities, there is no meaning of it. You can take a COVID-19 situation, and of course, the children are vulnerable and we need to protect them. At the same time, the children also need to be involved and their views also need to be here. For example, now the government is planning to reopen the schools. Are we hearing their voices? So as per my opinion, what I'm saying is, before reopening of the school, at ground level, there should be a parents-teachers meeting and the meeting with the children, and they should decide whether schools to be open or not. And someone that should be to facilitate them to take a decision, because they know the ground reality. The parents and the children, they know the reality, and they are the person to decide it. So what I'll say is, regarding the reopening of schools, the government should give flexibility, and the district administration need to conduct the ground level meeting and they need to decide. It also ensures the participation of the children. And the second, children have a right to live and right to survive and develop healthy lives. It's Article 6 talks about the right to live of the children. So any disasters, if you take, it may be like COVID-19, biological disaster or pandemic, or even earthquake or a flood or cyclone, the children are directly affected. Many times the children got injury and they may die. Even in COVID-19, some of the children has been died. Though the children are not the face of COVID-19, but they also being affected. Okay, and if you take any disasters data, the child death rate is higher than the adults. Okay, so the children, the right to live of children is being affected at the time of disaster. So what we need to do, how we are going to protect and fulfill the rights of the children? About the do's and don'ts during any disasters. For example, COVID-19, there are do's and don'ts. Pradhan Mantri Narendra Modi has started a campaign on Jan Andolan. We have to teach our children what are the appropriate behavior, okay, which also ensures the right to live of the children. And many children used to play games, and it's a rainy season in most of our country, and we need to know when it's raining or when it's lightning. We should not use the mobile phone, or the TV should be switched off. These are all certain do's and don'ts which we also need to educate our child, and which will help them, which will ensure the right to live of the children. So similarly, if you take any types of disaster, the children are being directly affected and their right to live is being questioned. So it's all stakeholders' responsibility to ensure the right to live children. So the only way is to enable our children and to enable our children in this disaster risk reduction activity. And we also need to in the life skills among our children, like swimming, tree climbing, or first aid. These are the things which is going to help our child. Just education alone is not going to help the children. Generally, just people used to say a story like a boy from who has gone to a city for education purpose, and after completing his higher studies, and he was back to his own village. So at the time, he was supposed to go across the river by boat to reach his own village. So what happens when he was entered into the boat, and he was just started discussing with the boatman, and he was asking, Dada, आपका science मालूम है? The person boatman told, no, I don't know science. I didn't even not gone to school at all. You have wasted your life. Half of the life has been wasted. And then the student started asking, mathematics? And he said, no, just I know how to count the money. I don't know this mathematics, sciences, theorem. Like he was saying, you have totally, your another half of the life has been wasted. Your entire life is wasted. Like he was discussing with the boatman. And after some time, the boatman started asking a boy, Are Baba, you know swimming? Then the boy told, no, I don't know swimming. You don't know swimming, now your life is going to be lost. Your life is also totally wasted because there is a hole in the boat. Because of the water, what is coming inside, the boat is going to immerse in water. I know swimming, so just I'll escape myself. I'll save myself. You do not know swimming, so you are going to lose your life. See, this is an example why I'm saying the story. Just education alone is not going to save the life of the children, or not alone going to help the child. So it is also very essential to teach our child with some certain life skills, which is going to ensure the right to live of the children. And as per Article 9, the children also have a right to be with their parents. The children should not be separated from their parents unless it is for their own goodness. I just remember, like almost 20 years back, what happened in my village. I think my village is called Nedungulam, which means a lengthy pond. Parallel to a village, there is a lengthy pond in my village. And there is a small settlement in one side, another main settlement, main habitat in another side. So what happens once the tank got filled, and the people have understood that the tank may broke at any time. So the main habitat people have gone to the small hamlet, and they have brought all the children first to save them. And their parents were interested in taking their valuables and their other like livestock and everything. So before the parents arrived this main habitat, the tank bundle got broken and the water was flowing continuously for 2 days. And only the children were saved, and the children were kept in the main habitat. The parents were stuck up in another place. So just imagine that without their parents for 2 days, the whole children, almost 50 children, were crying. See the situation, how no one can control them except their parents. So why I'm saying this, many times because of disaster, the children were being separated. It also affects their mental health many times. And after after flood or after cyclone, what happens? We used to keep all the people in the relief centers. And in the relief centers, sometimes the men are not allowed. But many times the children were fond of their father or mother. So they were forced to be separated from their parents. And even in COVID-19 situation also, many people got struck, and their children were in some place and their parents were gone for a work, and they were unable to meet their children for a longer period of time. So why I'm giving all these examples are the disasters were making children to be separated from their parents, which also has a huge impact on the mental health of the children. So in that case, what we need to do, it's all our responsibility to ensure that the children should not be separated from their parents unless it's for their own goodness. Even nowadays, for education purpose, we used to send the children to the hostel. A private third standard, fourth standard studying boy has been kept in the hostel. Just imagine how the child can survive there. So, like I was explaining about the cyclone situation, in that condition, in case if the what we have to ensure, the parents or the women who is having a child should have a separate place so that the children will not be separated. And in case if you are going to evacuate some people who are strapped up in the water or earthquake somewhere, you need to ensure the children and mother both are not separated, right? And as per Article 28, the children have a right to education and primary education should be free. Okay, and we all aware that when any disaster occurs, first it disrupts the education of the child. In coastal area, you see from Tamil Nadu to West Bengal, yearly 3-4 cyclones we are facing. So when the cyclone, after cyclone, the people, all the schools were being used as a relief center. All the people are kept in the school. So naturally, the children's education is being disrupted. It's also affects the right to education of the children. So first thing what we need to do, the schools should not be used as a relief center, and we need to develop an alternative mechanism for that. And many coastal areas were coming up with the relief centers like a temple and other multi-purpose plazas were also being constructed at coastal area to avoid this. And COVID-19 is one of the example where you can understand how the education of the children are being affected, right to education. Almost more than 6 months, the schools were being closed. Somehow we are trying to provide online to children, but all the teachers were know that it's not to equal to the education which we are giving in the school or the physically when the student is being presented. And there are many issues. Children who are not able to afford to internet or not able to have not having electronic devices, and a girl in a Kerala who has had a suicide because he was not able to access to the online education through television. See, this right to education is also having impact on the right to live. So it's all our responsibility to ensure the right to education. Right to education means it's not just only going to school. When the children were going to regularly, after disaster, what happens? The schools were being closed for a longer period of time. Their education is being affected, right? And even the school buildings were also damaged. And after disaster, if you see, there is a chance of huge number of dropouts. Now, this UNICEF has come up with the data that there is going to be a lakhs of students will be dropped out after this COVID-19 situation. And Dr. Suresh Kumar used to say that once you are practiced for 24 days or 20 days continuously, then that will become a habit. Now, more than 6 months, the students school. How again they will back to school? It's all a question mark. And similarly, when any flood or drought happens, the families were losing their livelihoods. So when they lost their livelihoods, naturally they were unable to pay to the school fees and all. So it's also makes a dropout and it also affects their education. So this COVID-19 situation learning to us, even at emergency situation or at any disaster, we can ensure the right to education of the children through online education. So in future also, we need to ensure the right to education of the children at a time of emergencies by providing online education. And as per Article 24, the children also have the right to good quality healthcare and nutritious food and clean environment. So this is one of the most important rights of the children for their development. right? So here I would like to just brief about the life cycle of the children. Here we can divide children into 4 different phases. The first phase is called prenatal. Okay, it's the pregnancy stage. Okay, the child rates also starts from this prenatal stage itself, and we all aware that the first 1,000 days, 9 months of pregnancy, and first 2 years of life of the child is most delicate as well as highly vulnerable phase for the children. So this first phase pregnancy is called prenatal, and the children born or inborn and their mother both are highly susceptible to the direct and indirect effects of the disaster. And well-timed access to the obstetric care for childbirth and antenatal and postnatal services are the needs and rights of this phase. So the mother who are pregnant, they have a right to get obstetric care, institutional delivery, facility of institutional delivery. Just I would like to give an example and ask a question from you. Suppose there is a village, okay, which was completely surrounded by a flood water, and after that, what happened? There is a village which is completely surrounded by flood water. There is a pregnant woman who need to access to the hospital for a safe and institutional delivery. Okay, but the village is completely surrounded by water. Roads were blocked. In that situation, how will you ensure the safe delivery of the women? It is their right as well as need. Anyone, you can also answer orally, or you also can write in the chat box. Anybody? How will you ensure the access to the health facilities for that pregnant women? Okay. Anyhow, let's see. First thing, there is a National Disaster Response Force, which is called NDR. Anybody, if struck up in any disaster, who need an evacuation, you can contact NDRF, and they also have a well-trained person with all the health facilities who can provide a obstetric care to the women, and they can reach any part, any place. Okay, this is the first you can do. And second, if you have a facility of heli ambulance, you can also ensure it. And the third one is, if nothing is available, what you can do is at local level, at village level, if anybody is there is any person who is trained, who is certified to look after the delivery, if they are available, we can use their service. But the best example I can say that is, you need to list out the mother who is expected to deliver on that particular date. I can say Odisha is one of the pioneer state in doing this child-centered disaster risk reduction. And what they used to do is, they used to list, and of course, all Anganwadi centers, they are maintaining the list of mothers, list of women who get pregnant and with the expected date of delivery. So if you know there is going to be a cyclone or flood in that time, you need to shift them in advance to the safest place, so that you can save that child and mother, and you can ensure the obstetric care for that particular women. The second phase is called 0 to 2 years old children. They call infant. Okay. Young children between 0 to 2 years old, they need 2 to 3 hourly feeding. And among these 0 to 2 years old children, they need more care up to first months, right? And they also receive exclusively breastfeeding or mother feeding. And after 6 months, they can be supported with any appropriate complementary feeding. And many times what happens because of these disasters, these children are also being affected. And what happening is, they may not get the appropriate complementary food. And we used to keep all women and children and men in one particular place in the relief center. So the women are unable to feed their child, and they feel shy or they feel discomfort to feed their children many times. and the event of disaster itself many times leads to the lactation failure, which is also a result of psychological shock. And major issues that severely affect the child's health when there is a lactation failure, which also affects the health of the children. And this loss of care is also another issue when a child between 0 to 2 years old, if they lost their mother, just to imagine about their survival and growth, it also affects their survival and growth. Okay, and due to disaster also leads to mass displacement. So this immunization is also an essential requirement for the children of 0 to 2 years old, infant stage. See, this COVID-19 time also, many children, they were is also disrupted. Okay, just I'll give an example and like to raise a question here. Suppose due to this COVID-19, the people have lost their employment and everything. After the situation become normal, a group of families were traveling from Chennai to Hyderabad for their livelihood. Okay, and because of that, their children were not immunized on time. In that case, how will you ensure their children were immunized regularly? See, here everyone is responsible. Now the government of India is having a provision of that. In any primary health center, anybody can access for the immunization, right? So it's a responsibility of village health nurse origin. Like in Chennai, they need to check if the families are being migrated. They have to contact and inform the VHN or any ASA worker in the Hyderabad, in the destination. They need to inform them, ensure the child is get vaccinated. Or they also can contact the mother and inform them, this is the date for vaccination of your child, go and access to the nearest primary health center. Okay, and even still now we also need to have a use the geographical positioning system GPS, and if your mother is migrated from one place to another place, by the automatic message or automatic call also will go. And this is of the health center or primary health center, you go and access it. So these are the certain ways to ensure the right to good quality or right to also important life cycle with the brain development happens. It's a 3 to 5 years, 3 to 5 years old called early, we can say. So in this stage only majority of a special factor for the development of the child. And these damages and loss of Anganwadi centers can also disrupt the early childhood education services. If you see in our country, depending on Anganwadi center and schools for their nutritional services and primary like childhood education, right? So this COVID-19 also you can just remember many children were affected without their nutrition, and when in the coastal area or in any other disaster affected area, if the Anganwadi centers were damaged and there naturally the nutrition services were disrupted. Okay, this is the reason the government of India and many state government has been come up with the initiative of providing take-home rice to all the Anganwadi children during this COVID-19 situation. The Anganwadi workers, they visited each and every household and they have provided the take-home rice to protect the children from COVID-19 and also to ensure the nutrition of the children, which also the rights of the child, right? Years old, which is called middle, we can say. And formal schooling and recreation is sports are the essential part of the development of the children, And when the disaster strikes, this all gets affected. So you all remember now, you can understand 90 children were not able to go to school and their movement was restricted, their recreation and sports were also affected. So in the post disaster situation, when to reopen, it also. So what we need to do is to ensure the right to education and right to play of the children. We need to promote the child-friendly spaces. We need to promote the child-friendly spaces in the relief center, and also we need to. I can say that again, this Odisha is one of the pioneer in protecting children from the disasters. And what these Anganwadi teachers and the school teachers, they relief center, and they used to establish the temporary relief centers there, temporary schools or Anganwadi centers, and they provide early childhood education, and these were also provided to the children in the relief center itself to ensure their recreational activities. Of course, 12 to 18 years old were called adolescents, and we are all aware sexual and reproductive health is particularly time of disaster. I just remember during this COVID-19 initial lockdown, many adolescent girls who were unable to access to the even sanitary napkin. Even the shops were forced to close and no shops were opened. The sanitary napkins were not available at the village level, and their movement travel was also restricted. So they were not able to purchase. They were not able to go to the shops. So many children, young children, were were facing a problem to access to this sanitary napkin, which is very essential during their menstrual hygiene. And many times during the disaster, what happens? The child production gets compromised, and this COVID-19, you can everyone knows that the number of child marriages were being increased, and after this cyclone or flood or any earthquake, by using the uncontrolled law and order situation, there is a chance of child abuse or kidnapping the children, right? So the child protection gets compromised at the time of disasters, and the children are also vulnerable to like child marriage, child labor, and usually after disasters. Okay, and as per Article 31st on UNCRC, all children have, and this COVID-19 has affected it. Many children, they was restricted within their houses, and they were unable to play, and they were unable to move outside. And if any disaster happens, if the child goes and play, what be happening? But it's not right. It is not correct. It is their right. Manisankar Iyer was a minister. Mr. Manisankar Iyer was a minister, and he was visiting to the Kerala and asking about their parents. What do you need for your child? They were asking for a bread and a job, and they were asking for a chocolate and other things, dresses and everything. And simultaneously, the minister was asking a boy, one child, and they were saying, I need a cricket bat. See the difference. That's what they want. That's what their needs and their rights. It's our responsibility to ensure it. Of emergency, or at the time of lockdown, or at the time of disaster. It may be any time. The child rights should not be compromised. It needs to be protected and fulfilled. And the child also has freedom. They also have a freedom of association. They have a right to meet together and join groups and organizations. And many times this is what lacking our society. I can say that, of course, the children got a chance to meet their children, but they were not forming a society or groups. And they were willing, the parents were not accepted it. So it is also their right. And the child also has right to privacy and law to protect them from attacks and against their way of life. So, and the children with disabilities have a right to special, any kind of disability have the right to special care and support as well as the rights in the convention. That is the reason the state governments and central governments were coming up with the special schemes for the differently abled because they need a special care. And I would like, if you are in the field of disaster risk management, we need to give a special priority, or we need to give a special focus on people with disabilities, children with disabilities. They are the most vulnerable group. You know that women, children, elder people, they are vulnerable, women. But I can say that children with disabilities, the most vulnerable group which need a special care. Interest of the children must be the primary concern in decision making. So whatever the decision which you may take, it should be based on the best interest of the child. If you want to send your child to the school, or if you want to send your child to the hostel, it should be based on the interest of the children, and their voices also need to be heard. It also applies to the all the contexts. It may be education, or it may be a decision making, it may be a governance. That's the reason we are also coming up with child-friendly governance, child-friendly village panchayat, child-friendly spaces, right? And make all measures to ensure children's rights are respected, protected, and fulfilled at all the times. And the education also should develop children's personality, talents, and abilities fullest. And the education which is being provided to all the children nowadays, it's not. And if you ask a boy who has completed degree, if you ask him to can fill up a challenge, he will refuse because he's not aware of it. And the children who knows everything, all the numbers and mathematics and everything, if they do not know the first aid, or if they do not know how to save themselves, or if they do not know swimming, or they do not know tree climbing, what is the use of it? If they are going to lose their life, what is the need of learning all these education and other facilities? So it's all a responsibility to ensure that the education also should develop the children's personality and talent and abilities which will help them to save themselves from any emergency situation, right? Okay. So overall, if you see, the disaster is directly impacting on the life of the children through child trafficking and child labor, sexual exploitation, and early marriage, right? So this each activity like child marriage or sexual exploitation or child labor or trafficking, which also has a huge impact on the life of the children through their life cycle. Okay, if your child is facing a sexual abuse at the age of 5 or 10, which has a huge impact on their entire life, which also affects their mental health. And if your child get married at the 13 years old, and she will become a mother-in-law, and the child which is not having a good health to bear a child, and which also make the child to malnourished, which also leads to child stunting and child wasting. To protect and fulfill the rights of the children at the time of what we need to is we need to strengthen the accountability mechanism between duty bearers and right holders. So as earlier I said, like among the children, parents, and with the pregnant women, we need to educate them and we need to create awareness among them about their rights. Are at the time of disaster rights. And simultaneously, we also need to educate the stakeholders to realize their responsibility so that they can fulfill the rights of the children. Okay, so one side we are strengthening the accountability mechanism between right holder and duty bearer, and another side there are also certain policy changes, and the practices also need to be changed. So the practices means from our, it should start from self. When you start give rights to, when you start protect and fulfill the rights of your children, it will reach the community. And there are certain institutes also need to be evolved, and the institutions also need to take fight for the rights of the children, and the people's attitudes also need to be changed towards protecting the rights of the children. So with this all, we can protect and fulfill and ensure the rights of the children. So overall, if you see, to conclude it, I can say that we need to protect the children from emergencies like in the disaster situation, and we also need to safeguard their rights by ensuring their rights. And we also need to involve children in the disaster risk reduction activities. Like, for example, if you take a COVID-19 situation, you can involve your child in making a homemade mask. If the child starts washing their hands themselves or wearing masks themselves, okay, and if they know how to wash the hands properly, okay, which all empowering the children. Okay, so with this way we can protect and fulfill the child rights even at the time of disasters and emergency. So with this, let me complete my presentation, and if there is any questions, we can go ahead. Any questions, if participants, if you are having, you can raise. Any questions from the participant side?
Veera sir, are you there? Yeah.
Thank you, Dr. Bal sir. It was a nice, wonderful session. Participant, you can ask any questions. You can unmute and ask, or you can put in the chat box.
I had actually posted my question in the chat box, but anyway, can I ask my question now?
Yes, you can ask.
Yeah, sir, my name is Varsha and I'm from Chennai. Sir, actually, the thing is there are lots of kids who are, unschooled or homeschooled nowadays, but they don't go to a formal education system, and they are probably given an opportunity to study whatever they want. So
okay,
parents here do only a job of, literally to say they are like drivers. Partially, I should say, I'm doing the same thing.
Your voice is too low, ma'am. Can you?
Sir, now,
yeah, it's clear.
sir. Yeah. So partially, even I am doing the same thing. My child is going to a Montessori school where he's now in first standard. But this year, because of this online classes, we have literally withdrawn our son from the school. So he is into multiple activities. So what happens is, here in Chennai, more than 700 students are there who are either unschooled or homeschooled. So what I wanted to know is, what kind of, is this going to actually create any kind of problem for the child in the future? Because as of now, what I've seen is the maximum is the kids have enrolled in the college. Like one of the student who was unschooled is now studying in Harvard University, London, who has not even written his 10th public or 12th public exam. But with merit seat, he's got into Harvard University. But this one is in terms of their development. But psychologically, I just wanted to know, is this going to be any problem for them?
From my perspective, if I see, even this online education, it's my personal opinion, it doesn't going to make a much impact on the life of the children in terms of education. And due to this school closure, there is going to be a learning gap between the children. Okay, and when the children were restricted with their movement and they were locked in the home itself, which also has certain health issues, there may be obesity, and their mental health also will be affected. Okay, these are all the certain challenges and issues the children will be facing. Okay, if Dr. Suresh Kumar, anybody also want to add, they can add.
Yeah, thank you, sir. Ms. Varsha, I would like to give on my input regarding that. To my understanding, for homing or if they can schooling at home or informal education also accepted. I think you all know that NIOS, National Institute of Open Schooling, there they can go for only, there will be a problem for them only when they go for government employment. Government employment, they are having the strict rules and regulations, and they are saying that 10 plus 2 plus 3. So if they have the 10th exam, 10th mark statement, 12th mark statement, and graduation, then they are eligible. The only place they will lack in that, as we said in the comment itself, a person who has done non-formal education or they have done a homeschooling, they got an admission at Harvard. Yes, these kind of very rare cases, but they can sustain from the perspective. But in general, private organizations, they are open to accept it. When you have the skill, they will accept it. But government, they are having strict rules and regulations. For that, I can suggest that ask them to write SSLC and plus 2 in that NIOS. That's enough. And there is one more statistics is there. When I was discussing with Balu sir, also I told them it is about regarding that number of persons who are clearing NEET and GAT examination and almost all the higher education institutions common entrance examination. When you look at the number of people who are cracking NEET examination, those who has done in NIOS. NIOS in the 2018 and 19, when you go to the website, they proudly said that our students are 5,000, more than 5,000 plus students were cleared NEET examinations. So see that even homeschoolings are better option. But psychology, I can say, what kind of impact it will make when they take a school education. If they take an education at the school or in different mode, they may have that, we have to go for formal education. See, it is for social peer understanding, and then how they can understand that to build a relationship, and they know that what is good and bad. And when they were taking at home, they will take only one perspective. For multi-perspective, they can take. And every class, they may have the 5 to 6 teachers will be there, and every year they will have different teachers, and they will get a more exposure and more understanding about the world. That's the only benefit they will get. But when they're taking education at home, what the benefit they will get? They are more focused on whatever they like to have it, and they will study. So that is the basic difference as per my knowledge. And in both way, when we take education at the school or at the home, positive things are the negative things are. So that's my input for your question. I think that's value for your yes.
Thank you, sir. Thank you so much.
Sir, and one more question, sir, regarding what's your opinion about online class, sir? There is a question from Resma. Online class, I think you witnessed your children also doing online education. What's
the first question itself, I don't trust on online education, and I also take last 6 months I have conducted more than 25 online training programs. What's happening is people just log in and keep the mobile and are there running. Just for the namesake, they are joining, but there is no much learning it. Once they are interested in that particular subject, then only, or if they are interested with if they are like their teacher, then somewhat they are learning. Okay, what I have observed in my home, my son, they never sit more than 5 minutes, they never sit in front of the mobile. When their teacher calls, yes, teacher, that's all. Yes, miss, I'm there.
So the voice is not connected, I think. I hear you. What is that? Yeah, I agree with you that what you said. Your voice is, we are not audible.
Sir, maybe we can send him.
Yeah, maybe network issue, I think so. And I have to agree with that. Online education is highly effective and efficient only when the participants are interested. That is the only thing. If they are committed to participate, if not, then that's not a best option for them. And for I can say that in coming days, without online education, we cannot continue. That is the thing we can say that.
Sir, but I have a small point here, sir. But nowadays,
Uh,
with so many classes going on online, having
uh,
for long hours sitting online, I think that also is creating an issue. Maybe if they have short durations with more of
yes.
AVs
Love,
to explain self-explanatory videos.
definitely. There is a very good introspection from your side. Definitely, there is a study saying that when we give an information for shorter period of time, and they will engage them. I can say some of the school they are starting in the morning 8 and then they are taking class up to 4:30. How they will sit in a place? And I think that is a right suggestion. And one more thing, there are many schools they are not following. They are not understanding that mindset of us. Even I can take myself. How many hours I can sit in front of the computer? I will learn. Whenever I feel more tired. And most of the institutions are not asking to switch on the video. That, that is the are not attending. I can say that the self-regulations are not made for this component. When we train our students and children for this new normal, definitely they will come back. And if you are not giving that, unless the self-regulated self-commitment is not there from the learners, it is very difficult to ensure the effectiveness of an online learning. And even I too agree, and there is a positive side of online education. I can say there are a few complaints from the parents saying that my children are spending most of the time in mobile phone. That is a statement I'm receiving from them. But when the online classes comes and they are spending for quality work, attending the class, for example, the gratification diverted to that attending online class. Okay, they spend 3 hours in the mobile phone, and in a day they are spending 6 hours, and 3 hours is for quality one, and 3 hours for the personal and entertainment purpose. That is another positive feedback I got it recently from one of the parents. That I share with you. Balu sir, are you there? I think we are not able to hear you. There is a network issue, I think so. Sir, Salim sir? Yes, Salim sir, are you there? Yes, sir. You can give the feedback on Dr. Subhasri ma'am, what of time?
Thank you, Dr. Suresh sir. It was a wonderful session, 255th session about child rights. Today's resource person, Dr. Balu sir, very clearly talked about United Nations Convention on the right of the child. So in all the dimensions he explained, like strengthen the mechanism, accountability mechanism, a lot of aspects he very clearly explained. And today a lot about inside about the articles. He mentioned 50 over articles. I think major articles like 6, 9, 12, and 28. There are major articles he beautifully explained. So I think all the aspects like civil, political, economical, like social, cultural, all those things very well clearly mentioned in the articles. It was a very good learning today. And there are a lot of general principles they explain, like best interest of the child and non-discrimination, development, views of the child, all those things. And beautifully explained, Balu sir. And major rights. The very important thing is we have to know survival, right to development, and protection, participation. That are the major rights. And I think coming to the part of strengthening mechanism and the right holders' positions, duties also there, as well as duty bearers. So both has to be enhanced to to development the policies and livelihood of the children, and empowering the children is very important, as he said. And the emergency disasters things, safeguard rights, all those things we have to empower, teach the children. We have to give the awareness and as well as education about the disasters. And I can good talk about the phases of the children's, like first phases prenatal to like adolescent. It was a very good classifications, and we understand better. And it important to note that adolescent is the very like highly vulnerable to the problems like child marriage and child labor, gender-based violence, and trafficking, usually after disaster. So these things to be created to the awareness on children. So it was a wonderful, great session, sir. Thank you very much.
Thank you,
And
Salim
finally,
sir.
just I want to put one word, sir. During the like tsunami disaster in Nagapattinam, my father-in-law was SP. He handled very well, like about the children's who were away from the parents. So it was almost 50 families. They lost their children, and father-in-law said he associated, and all the families are united. I think that was the thing he handled at the time of a disaster in the Nagapattinam tsunami period. I think Balu sir knows that. So just I want to mention, since it was a disaster topic, just I want to mention. Thank you, sir.
Thank you. We're happy to hear about it, sir, Salim sir. And ma'am, I request Dr. Subhasri to deliver the water thanks for today's session.
Thank you so much, Suresh. Am I audible?
Yeah, you're audible.
Thank you so much, Dr. Balu. That was a fantastic session. You covered the entire spectrum. And also, I really like the way you have touched on the psychosocial aspect also. And thank you so much from the Department of Psychology, Madurai American College, and the other associations like Madras School of Social Work and Red Pond Academy and other collaborators. Thank you so much for your wonderful session, expertise shared. I think it is the first session we are having it on child protection and child rights. That is a wonderful beginning. I think it is very much needed. I know this COVID has also been announced as a disaster. So we have to be really taking care of this aspect. Thank you so much, Dr. Balu, for your wonderful expertise, wonderful presentation. Thank you.
Yeah, thank you so much, ma'am. I also extend my sincere gratitude to all the associated institutions, my American College, MSSW Wellbeing Center, and other institutions. Thank you so much.
Thank you, sir.
Thank you.
We'll meet in the analysis.